Good afternoon and welcome to Health Hub. My name is Susie Tomlinson and I'm a neurologist here at St Vincent's. Today we're talking about migraine, and just as a disclaimer, this video contains information of a general nature, and if you have questions or issues that relate to you, please do speak to your health provider about the information. So I'm pleased to be talking about migraine today because migraine is a really common problem. It affects around 18% of women and around 6% of men. And at this time, during the coronavirus lockdown, a lot of us are working from home and spending a lot of time in front of screens. Maybe we're not sleeping as well or under stress. So we might be more likely to have a migraine. So it's very timely to be talking about it. At the outset, I would say that if you get migraine, it's important to talk to your GP about having a migraine management plan, because there's a lot more to migraine than just taking paracetamol or codeine and going to bed. What is a migraine? Well, generally a migraine is thought of as a severe headache that lasts between 4 and 72 hours. It can be a generalised headache, or it can settle on one side and sometimes settles behind the eye. It can be a pulsatile headache, a stabbing headache, a pressure type headache, and about 30% of people with migraine can have a visual aura before the headache sets in, and this can be characterised by spots in the vision, scintillations or jagged lines in the vision. Migraine is often associated with neck pain or pain at the back of the head, and a lot of people develop nausea and vomiting and significant sensitivity to light and sometimes sound and smells as well. There's often a drive to want to sleep it off, and it's often associated with yawning and fatigue as well. So a moment to talk about prevention of migraine. If you have a susceptibility to migraine, there's a lot of things that you can do to try and minimise the onset of the headache. Sleep is a really important factor in migraine, and it's generally hours before midnight that counts. So it's helpful to go to bed early and get a good night's sleep if you're a migraine sufferer. And if you think you might have sleep apnea, then it's good to get that checked out, because that can contribute to headaches, particularly morning headaches. It's important to avoid long periods of time at the screen and having poor posture in association with that. And you can do well to maintain your hydration. Drink lots of water, try and minimise tea and coffee and caffeine, and try and avoid excess alcohol, which sometimes can be an independent trigger for migraine. And even a focus on exercise and nutrition and improving the general well-being and physiology of your body can help reduce the impact of migraine on your life. There's also evidence to suggest that B2, riboflavin supplementation and magnesium can help reduce migraine starting. So a word on management of migraine. Again, what I would suggest is, if you have a tendency to migraine, to see your GP for a specific plan about how to manage your headache. Half or more of patients will have infrequent, occasional or episodic headache. And in that situation, when the migraines aren't frequent, then the focus on medication is directed at that specific headache. However, 50% of migraine sufferers or more have frequent migraine and sometimes daily headache. And in this situation, the migraine can be very disabling and disruptive to life, and you can lose a lot of time with productivity, attending work or social functions, and generally engagement in life. So if you have frequent migraine or daily headache, there's a paradigm shift in the management away from the symptomatic treatment of the individual headache and more towards the preventative medications. Generally, the cutoff is if you have more than 4 headache days a month or daily headache, that's when we would focus on prevention. Going back to the individual treatments, often aspirin is a very good first-line treatment of aspirin, but the key is to get in early. So as soon as you become aware that you're having a migraine, you take your medications such as aspirin, or even a combination of paracetamol and ibuprofen or indomethacin can be effective. But if you get in early and stop the evolution of the headache, then you can limit the impact of that particular migraine. If these measures are ineffectual, then you might want to talk to your GP about a class of medications called triptans. And these medications are migraine-specific medications that you take again at the onset of the headache, and they stop the evolution of the headache in some patients to evolve into a migraine. As I mentioned, if patients have 4 or more headaches a month or daily migraine, the focus is on prevention. And in this case, you may need to take a tablet every day to stop those frequent headaches and that cycle developing. There are several tablet options for migraine prevention, and it's about going through which one would be most suitable and most effective for you. And sometimes you might need to try more than one preventative tablet to find one that's effective in your situation. There's now a new medication on the market that's a self-injected monthly injection that is migraine specific, and this has been an exciting advent in migraine prevention in the last 12 to 18 months. These medications block a neurotransmitter called CGRP, and again, I'd talk to your GP about whether it's appropriate for you. In some circumstances, Botox can be used on a 12-weekly basis to prevent migraine if it's indicated in a particular patient. So the take-home message is that migraine is very common in the community, and if you suffer migraine or have a tendency to migraine, do talk to your GP about a migraine management plan. Lifestyle measures are important, and there's a lot that you can do to try and improve your health and minimise the impact of migraine on your life. If you have a headache, treat early, and if you have frequent headaches, then think about a preventative. So if there are any questions, leave the comments in the box below and we'd be happy to get back to you.